Okay. Okay, my name is James, and this is AW. She is here for an exam. Why are you here, ma'am?
For a well visit.
Okay. Do I have permission to record you for my class and my teacher to upload to YouTube?
Yes.
Okay, great. So, first of all, when was your last doctor's visit?
Last month.
Was that your primary care physician?
Nope.
Okay. Can you give me any specifics of why you went to the doctor?
Kidney stones.
Okay. Okay. So, since we're already right there, what was the situation with your kidney stones? First of all, have you had kidney stones before?
Yes.
When was the first time you had them?
Last year.
2019?
19.
Okay. What happened with that? Like, how did you get diagnosed with that, and what happened after that?
Basically fainted at work.
Okay. All right.
I had to call my kid to come get me.
Mm-hmm.
A lot of pain.
Mm-hmm.
Went to the ER. That's
Okay.
what they said. Did an ultrasound or CT. So,
Okay. Did they do any procedure to get rid of them, or like a lithotripsy or something like that?
yes, they did. They blasted it.
Mm-hmm. Sound blast. Okay.
Yeah.
And when was that?
Middle of 2019.
And what did they tell you to do post procedure? Like, what were you supposed to do after that?
Drink lots of water.
Okay.
Stay very hydrated and stay away from caffeine.
Okay. Have you had any trouble with your kidney stones since then?
They have come back, yes.
And what did that entail?
Same thing. Lots of pain. I just know how to deal with it now.
But you haven't had any other procedures since then?
No.
Okay.
No.
And your last time you had an issue with that?
Last week.
Okay. All right. So that's some very specific information that we normally would get into later, but since you brought it up, I just went ahead and went into it. So I'm going to go back a little bit now. Tell me about your past medical history besides the kidney stones. You have any other issues? High blood pressure, diabetes,
Nope.
heart disease? No.
No, sir.
Hepatitis, asthma?
No, sir.
The procedures, any medical procedures? Obviously, you had that kidney stone taken care of. Have you had any other medical procedures done?
Surgeries.
Yes. Sure.
So, arm, hand, elbow.
All together, or
All different. All different.
okay? What was going on?
Horse.
Horse injured you.
Yeah.
Okay.
So on both hands, on both arms.
So you had them surgically fixed?
Yep.
Okay. When was that?
From 1986 to last year.
Okay.
Well, no, 2018. That was the last. break that I had.
2018.
Yep.
So 3 separate injuries.
Total, Lord, there's probably more than I could imagine, but I know that I had, there's a pin here, pin here, pin here, 2 pins here, both on my wrist. So 1, 2, 3, 4, 5, 6, at least 6 on my arms.
Okay. That sounds painful. Okay.
And then a cesarean.
C-section 1.
Mm-hmm.
Okay.
And had my appendix out. That's it.
When was that? Do you remember?
Yes, 2000. It was right after Mass, 2006.
2006. Okay.
Mhm.
Gotcha. All right. You have any depression, anxiety, suicidal ideation, anything like that?
Nope.
Never been depressed?
Nope.
Clinically, that is?
Nope.
Okay. Are you taking any medications?
Progesterone,
Just around. What do you take that for?
hormone regulation.
Okay. How long have you been taking that?
About 2 years.
Do you know the dose by chance?
200 milligrams a day.
200 milligrams. Take that in the morning or night?
Night.
Okay. that's the only medication you take?
Mhm.
Okay. Alright.
I take supplements.
Okay, what type of supplements are you taking?
DIM,
Dim, what do you use that for?
hormone regulation. I can think. So DIM, vitamin D, B,
Mm-hmm.
and then just recently started the C and the zinc
Okay,
for COVID.
okay. What type of hormones are you taking?
Bioidentical pellets.
Bioidentical pellets.
Mhm.
And who does that? And do you know the dosage by chance on that? Like, how often do you do that?
It's supposed to be every 4 months.
Okay,
125 milligrams, was it?
okay,
She didn't do any estrogen, so it was just testosterone.
okay.
And then what was the other question?
How long have you been doing that?
2 years.
For 2 years. Okay, great. When was your last menses
Oh, that's right.
period?
Last week. So the end of October.
Do you have a OBGYN that you see regularly?
I have one, yes.
When was the last time you saw them, him or her?
2 years ago. No, yeah, 2 years ago.
Pap smear included?
Mhm.
2 years ago?
Mhm.
What about mammogram?
Then. I had
2
to go.
years?
She said I don't have to come back until 40 for the breast exam.
For how many?
mammogram.
For how long?
Till I'm 40. So then that was 2 years, so 5 years. I was 35, and it will be 40 when she tells me to go back to do the mammogram.
Oh, the mammogram, not the breast exam though, a manual exam.
Correct. The
Okay,
mammogram.
got you. Okay. So at 40.
Mhm.
And annual paps, did she say that you're supposed to have those done annually?
Yes.
Do you have any drug allergies that you know of?
Nope.
Nope. Food allergies?
Nuh-uh.
Allergies to latex? Anything like that? Environmental?
Nope.
Nope. Okay. Okay. All right, let's talk about your family history. Is your mother alive?
Nope.
How and when did she pass away?
1989. Overdose to black tar heroin.
Okay. What about your father?
He's alive.
Is he healthy?
He has hepatitis.
Which one do you know by chance? Like, is it liver or is it?
The other one. It's the one from 30 Needles, probably.
Okay, that's okay. All right, let's go with grandparents. Any grandparents alive?
No.
Do you know any of them, any of their health history?
Yes.
That might be pertinent. Go ahead.
My paternal grandmother is the only one I know about.
Paternal grandmother.
Yep, so my dad's
Okay.
mom. She had breast cancer, cervical cancer,
Mm-hmm.
ovarian cancer. And then ended up being thyroid cancer.
Sounds like a strong woman.
So, yes. She also had high blood pressure,
Okay.
and I think that was it.
Okay. So the cancer, I'm assuming, is what did her in.
Yep.
Okay. Okay. All right. Let's talk about your kids. How many kids do you have?
5.
5 kids.
Oh.
Start at the top. First one. How old is?
Well, how many did I give birth to?
Okay.
Is that what you're asking? Or just
Yes. Well, we'll get. Okay. Living and how many pregnancies have you had?
3.
3 pregnancies.
Yes.
And then, so how many actual kids did you birth?
3.
Okay. How old are they?
18,
Male or female?
male,
Healthy?
very.
Okay.
16, male, very healthy.
Okay.
And a 15, female, very healthy.
Female.
No
Healthy.
issues.
Okay, great. Okay. So I'm assuming you have other kids that live at home with you,
Two,
or did.
yes,
Okay, 2 others,
yes, the 2 bonus.
and they are, I'm assuming, adopted.
Well, they were my stepkids.
Okay, stepchildren.
Yeah, I raised them.
Okay. So who lives at home with you right now?
Julian and Madison.
So you have 1 boy and 1 girl.
Yep.
And that's the only people at home.
Yep.
Y'all 3.
Yep.
Okay.
And 4 dogs.
And 4 dogs. Okay. What is your relationship status?
Single.
Okay. How long have you been single?
A year and 6 months. A year and 5 months.
Okay. Do you feel good about your current home situation?
Yeah, very.
Great. Okay, great. All right. Are you working? Working full time?
Yes.
Are you secure in your job?
Yes.
Alright, good. What is your highest education level, if you don't mind me asking?
Bachelor.
Okay. What does your typical day look like? What do you do all day?
Weekday or weekend?
Let's go weekdays.
Weekday. Get up at 4:45.
Mm-hmm.
Go feed horses. Do well check on them. Go to work by 8. Work until 6.
Mm-hmm.
Go back to do horses.
Mm-hmm.
And then go home. And that's about it.
Okay, great.
Yeah.
And in your free time?
Horses, ride horses.
Ride
with
horses.
Kids. Yep.
Okay. Great. Alright. So tell me, do you eat well?
Very now.
Very now?
Yes.
So you eat plenty of fruits and vegetables and all that?
Yes.
Okay. Are you happy with your weight?
Yeah.
Mm-hmm. Great. Alright, let's see, moving on. Do you exercise regularly?
Yes.
Okay. I'm assuming that's taking care of horses.
And I work out every day, 6 days a week with a trainer.
Oh, okay.
And I've been
Good
doing
for
that.
you.
Yeah, I've been doing that for 4 months.
Alright. Do you use alcohol?
Not anymore. Not for 4 months.
4 months.
Mm-hmm.
You ever had a drinking problem?
I would say up until 4 months ago.
Okay.
I wouldn't say I had to like drink all day, but I would go home and immediately have 5 or 6, 7, 8 drinks. Doubles.
Got you. So you feel like you've got that under control now?
Oh yeah,
Okay.
for sure.
Do you need any assistance or help with that, those concerns?
Nope.
Okay.
That's, working out's great.
Do you use tobacco or do you smoke?
No.
Okay. Have you ever smoked?
No.
Okay. What about illicit drugs? Same question.
Nope.
No. Never done them. Okay. Great. All right. Use the seatbelts.
Yes.
Okay. Do you have a gun in the home?
Yes.
Okay. Is it safely stored?
Yes.
Do you know how to use it and how to store it, and you've been trained?
Very yes.
Okay. What would you say, are you religious or do you have a faith that you want to tell me about?
I'm very religious, yes.
Okay.
Christian?
Christian, okay. Do any of your beliefs conflict with any medical decisions or treatments you might need?
No.
Do you have any specific concerns about your sexual health?
No.
Okay, great. All right. Are you up to date on your immunizations?
Yeah.
Yes?
Yes.
Okay. You get good sleep?
Yes.
Okay. Alright. So that's pretty much most of your past medical history, I would say. Let's get down to actual body systems. And I know we talked about your kidney stones, so we might revisit that here in a minute. But let's just go through, in general, do you have any fever, chills, loss of appetite, fatigue, weight loss, anything recently?
Not unexplained.
Not explained?
Yeah.
What is explained?
With the weight loss.
How'd that happen?
Trainer. Stop
Okay,
working
so
out.
you're trying to.
Yes, for sure.
Getting in shape.
Well, I was, yeah. Not losing anymore.
Right. Now you're just trying to maintain what you have.
Yes, for sure.
Okay, I got you. Concerning your eyes, do you have any blurred vision, discharge, or redness or swelling into your eyes or of your eyes?
Nope, other than allergy seasons, that's it.
Okay.
But nothing happening right now.
So you're talking about seasonal allergies? You have seasonal allergies?
Mm-hmm.
Okay. Have you had an eye exam recently or in the past? When was the last time you had an eye exam?
Yes, actually, either either November or December of last year.
Okay. How'd that turn out?
Oh, great.
Okay,
No
no
issues.
problems.
Mm-mm.
You wear glasses or contacts?
Nope.
No? Okay. Alright, do you have any hearing loss, tinnitus, vertigo?
Nope.
Ever have it?
No.
No? Okay. You ever had a concussion with all those horses?
Yep.
How'd that go? Did you get any, looked at the time or no?
No.
No? How many concussions do you think you've had?
Between that and sports, I don't know, a lot.
Several?
Yeah.
Okay. Alright, but no stuff going on with your head that you know of?
No.
Okay.
I wouldn't.
Vertigo,
No.
ringing in the ears, nothing like that. Okay. Any frequency of nasal discharge, colds, that kind of thing?
No.
No. Okay. Any difficulty swallowing, anything like that?
No.
No problems with throat, nasopharynx, all this seems to be good?
Yeah.
Okay, great. All right, let's get to your cardiovascular system. You have palpitations or difficulty breathing, anything like that?
No.
Never had anything like that.
No.
Have you had a cardiac workup at all?
No.
No. Okay. Any difficulty with breathing, wheezing, cough, anything coming out of your chest if you cough?
No.
No. Okay. All right. Do you have any abdominal pain, constipation, problems with hemorrhoids, rectal bleeding, black red blood coming out with your stool? Any problems with your stool at all?
No.
Okay, great. What about frequency of urination, hesitancy? Any problems with urinary system besides kidney stones?
No, only when that's active.
Only when that's active.
Yeah.
Okay. Okay, as far as your female system, do you have any irregularities? No. Your menses are normal?
Yep.
On time? No discharge?
Like
Pain? Nothing?
Nope.
Abnormal bleeding?
Nope.
Okay. All right. Musculoskeletal system, do you have any painful joints or muscles or, muscle pain, decreased range of motion, anything like that?
My grip, that's about it, in this hand.
What's going on with that right hand?
Over the years, my grip has I've lost grip
So you're losing strength.
in this hand, yeah.
How so?
I've just noticed it over the years, like I'll reach to grab something and my hand will just give out, or really like when I'm trying to like lunge or get a wild horse or even just anything that's going on, just pulling in, that's when I notice it the most, is when I'm trying to grab, I can't. I always have to grab my left hand.
Are you right hand dominant?
Yep.
So has anyone checked this out for you? You feel like it's getting worse?
Oh, it is for sure.
So you're getting weaker?
In this hand, yes.
Okay.
Not in this hand.
Anything make it better? Or you just feel like overall you're losing weakness?
Nothing makes it worse or better.
Mhm.
It's just, I think overall, I don't know,
Okay.
gradually. I'd say over 5 years, I'd say it's probably gotten percentage wise like 5% worse.
Okay. Do you feel like you should follow up with that somewhere? Like a specialist of some sort?
Probably eventually, but not
Okay.
now.
Okay. Is it concerning you?
No.
Okay. All right. Then we'll move on. Do you have any, first of all, do you use sunscreen? Sounds like you're outside a lot.
A lot of it.
Okay. Do you have any skin lesions or
No.
unusual moles or skin, anything going on with that?
No, not from that. I mean, I have rope burn, but that's
Okay.
about it. That's from lunging.
Have you seen a dermatologist? Do you see one annually or?
No, but the last time that I went, in 2018 when I did the OBGYN the last time, she did a well body check and did a mole check.
Okay.
And everything was great.
2018?
Yep.
Great. Okay. Okay, do you have any, well, we talked about you have some motor weakness over here on the right hand. Is there any numbness or tingling to that?
No.
No. Burning, radiating pain?
No, no pain at all.
Okay. You have any memory loss, seizures, headaches?
Headaches all the time.
What kind of headaches?
Deep headaches. I'm
Where at? Which part of your head?
always right here. Right, over here. In the right bottom part.
When do you get those?
Randomly.
Okay, let me put it a different way. How frequently do you have them?
Almost every day.
Every day.
Almost. I would say almost like 90%.
And what do you do for that?
I'll take Motrin if it's really bad. If it's not, I try not to take anything. I just kind of let it go away.
Okay. Has anyone looked at that for you?
I mean, I just keep, I don't know.
No. Okay. All right. So you don't have anxiety, depression, mood changes,
No.
body problems. You said that earlier, correct?
Correct.
So, okay. Do you have any heat or cold intolerances?
I hate the cold, but it's, I can tolerate it. tolerate
You
it.
can tolerate it,
Yeah.
but not, you don't sweat for an unknown reason
Oh,
or
no.
get chills or anything like that. Difficulty swallowing.
Nope.
Nothing like that.
Mm-mm.
You don't have any. You're not losing your hair or anything like that.
No.
Okay. Do you have? Do you bruise normally? You don't bruise excessively?
No.
Mm-mm. No easy bleeding, anything like that. If you scrape your arm up on something.
No.
Okay. All right. And I think that's probably about it. Should be. Okay. Okay, well, I want to thank you for coming in. I appreciate it very much, and we'll see you next time.
Thank you.
Mhm.